Hello to all of our local residents and viewers from around the world. As you know, we are presently dealing with the coronavirus pandemic, also known as COVID-19, and it has affected the lives of practically every citizen in our nation. There are some common sense measures that we can take to prevent the spread of the coronavirus, and they are as follows. Wash your hands. Wet your hands and apply soap. Wash the back of the hands and between the fingers for an estimated 20 seconds. If soap and water is not available, use an alcohol-based sanitizer, which contains about 60% alcohol. Get a flu shot. It will not protect against the coronavirus, but it will help protect people from getting the flu. And the flu is what most people are likely to contract and become ill, thus tying up major resources by healthcare providers and hospitals, which at this time are needed to combat the coronavirus. Germ management. Symptoms of coronavirus typically occur within 14 days of infection and can include fever, cough, and shortness of breath. If you must cough or sneeze, do so in a tissue, and discard the tissue in the trash or cough or sneeze into the inside of your elbow. Avoid touching your eyes, nose, and mouth. Keep surfaces in your home clean. Countertops, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tables, TV remote controls, and bedside tables. Keep those clean. Stay at home if you're sick. If you have a fever, cough, or difficulty breathing, seek medical attention, but first call your healthcare provider or hospital before you visit, so that they can make the appropriate arrangements for your visit, to ensure that the best of care can be provided for you while reducing the risk of possible spread to other patients and healthcare providers. Put together a plan. Experts say that it is sensible to have 2 to 4 weeks of food and other household supplies, such as detergents, and there should be a 3-month supply of imported medications on hand. Social distancing. Don't attend concerts, festivals, sporting events, and crowd activities with greater than 10 people. Please remember to check on your elders. This message is brought to you by Wayne Pharmaceuticals and Dr. Wayne's Aspirin. I'm Dr. Wayne. Until next time, be safe. I'm Dr. Wayne, and welcome to the Dr. Wayne Health and Wellness Show. We will be providing our viewers helpful health information and easy daily tips that will aid you in becoming a better, healthier individual. This show is produced in Crisp County, Georgia, which ranks 152 out of 159 counties in Georgia in overall good health of its citizens. This low ranking is due to the high incidence of heart disease, diabetes, cancer, and strokes that lead to a very high premature death rate of Crisp County citizens. This is true particularly among African American citizens. Just like Crisp County, Georgia, there are many small, underdeveloped, rural areas across the country that are being faced with these same staggering numbers. As a resident of Crisp County, Georgia, I began to set out to improve the quality of health and life by informing individuals on the importance of being healthy, and also giving them tips on how to improve their overall health. In August of 2019, we began the health and wellness program for seniors at our 15,000 square foot gym facility in Cordele. This program provides supervised daily exercise and strength training along with blood pressure monitoring. The first 6 months of the program has been a huge success, as we've seen our participants lose weight and lower their blood pressures. It's believed that by providing more information to the public through this show, that we can increase the awareness of the many causes of so many health diseases. thereby giving all of our viewers the tools to aid them in the prevention of these diseases. In doing this, we hope to reduce the premature death rate not only in this community, but in communities across the world. This is our first show, and our topic for today is knowing your numbers. Vital signs are 4 barometers or gauges of the body's overall functions. They consist of the following: blood pressure, pulse, also known as the heart rate, respiration, and body temperature. The blood pressure has a range from 90/60 to 140/90. The pulse or heart rate is 60 to 100 beats per minute in an adult. Respiration is 12 to 18 breaths per minute in an adult, and this is at rest. And the normal temperature by mouth is 98.6 degrees Fahrenheit, and this has a range from 97.6 to 99.6. Each of these signs have a range from lower to higher that is considered normal, as I indicated when I gave you those numbers earlier. We will discuss the normal range in more detail in subsequent shows. Let's get into our topics for today and discuss blood pressure and pulse rate. Blood pressure is the most prominent of the vital signs. Not necessarily the most important, but it's one that we deal with on a regular basis, as we're constantly being reminded of this when we go to doctors and they're checking on our blood pressures. But the blood pressure is a combination of 2 pressures, the systolic pressure over the diastolic pressure. And to put it in mathematical terms, is almost written like a fraction, some number over some number. You've always heard doctors give your blood pressure as being described as something like 120/80. The top number refers to the systolic pressure. The systolic pressure is the pressure that is exerted or put on the arteries when the heart contracts. The heart contracts or pumps. It pumps blood out of the heart to the rest of the body by way of arteries. And the arteries are a passageway by which blood travels throughout the body to provide nutrients and oxygen to all of your various body tissues. The heart, when it exerts or pumps and puts pressure to push blood throughout the body, that is, as we stated, is the systolic pressure. That pressure has a normal range of from 90 to 140 millimeters of mercury. The pressure greater than 140 in many instances is described as high blood pressure. When the heart contracts and then relaxes after pumping the blood throughout the arteries, that relaxation pressure that is put on the arteries when the blood relaxes is known as diastolic pressure. That pressure has a range of from 60 to 90 millimeters of mercury. The lower end of that being 60, the high end being 90. So the combination of those two on the lower end would be what? The systolic over diastolic would be what? 90/60. The higher end of that would be 140/90. So we're talking about a range of from 90/60 to 140/90. Now, there are new standards that have been recommended by the American College of Cardiology. Those numbers have been lowered in recent years, and that has been because physicians are wanting to treat hypertension much more aggressively. So they consider pressures lower than the 140/90 as something to gain attention and something to deal with at an early stage. However, in most instances, physicians will not treat high blood pressure less than 140/90. So normal ranges for blood pressure is 90/60 to 140/90. Now, what would be, if I gave you an example of what I'm talking about? Let's say a blood pressure of 150/96. Is that considered the normal blood pressure? You would have to ask yourself, if that top number, which is 150, is it between 90 and 140? No. It's greater than 140. So that top number is higher. So it's out of the range of normal. So I gave you the diastolic pressure as being 96. Is that between the range of 60 and 90? No, it's higher than 90. So we say 150 over 96 is out of the range of normal. It's greater than 140 over 90. So what would we describe that? That would be described as being high blood pressure. The medical name for that would be hypertension. We would describe that as being a hypertensive diagnosis. Now, that would be classified as what we would call stage 2 hypertension by healthcare providers. 80 over 50, would that be considered a normal blood pressure? Is 80 within the normal range of the systolic pressure that we gave earlier of 90 to 140? No, it's less than 90. So it's out of the normal systolic pressure range. What about the 50 for the diastolic pressure? Is it within the 60, between 60 to 90 for the diastolic pressure range? No, so therefore an 80 over 50 blood pressure would be out of the norm, and we would describe that as low blood pressure. And the medical terminology for that is hypotension. We will take a break now, and we will be right back after this commercial break.
My name is Evan Edwards. I am the Director of Community Sustainability and Health Initiatives. We just wrapped up one of our health and wellness classes that we have every week, Monday through Friday from 9 a.m. to 11 a.m. It's open to the public at no cost whatsoever. And here we just do functional training, stretching, multiple types of exercises and cardiovascular movements to mimic everyday movements for our senior citizens and anyone actually that needs to come in and get a workout or has had some type of surgery or injury that prevents them from being as mobile as they'd like. We just partnered with Silver Sneakers, which is catered to members of the community that are 65 years and older. With Prime for anyone 18 to 64, we are one, if not the only, privately owned black fitness facilities in the state that offers these programs. We want to get everybody involved. We are doing many other things here at the MD Whitehouse Institute. We do toy drives, we do the food bank that's coming up. We're going to be one of the places that families that are less fortunate can come in and weekly pick up food and things that they need to take care of their families. We do health and wellness screenings, blood pressure checks, cholesterol checks, BMI, those types of things, just to keep awareness and consciousness to the community about health initiatives and nutrition classes, do vital signs classes, and eventually we'll do some resume writing classes, interview skills. And check us out. You can go on our website at mdwhitehouse.org.
Dr. Wayne's aspirin is a low-dose tablet that promotes heart health while reducing the risk of heart attacks and strokes. Heart disease is the leading cause of deaths of Americans. Recent studies have concluded that a daily low-dose aspirin also reduces the risk of colorectal cancer. Taking low-dose aspirin is not safe for everyone. Only take low-dose aspirin if your doctor recommends it. Try Dr. Wayne's aspirin, coming to a store near you soon.
Our next vital sign is pulse or heart rate. This is the rate at which the heart contracts or pumps per minute. The heart pumps blood throughout the body by way of passageways or vessels known as arteries. Every time the heart contracts, as we say pumps, it forces blood throughout our body. The pulse or heart rate can be measured at various locations throughout the body, but two of the most common areas are the neck, near the side of the windpipe, or the wrist, where you can place 2 fingers near your wrist between the bone and tendon. You will be able to feel a rhythmic pulsation up and down against your fingers. This is your heart rate or pulse. You may count them for 15 seconds and multiply the number of pulsations or beats by the number 4, and this will give you your pulse rate for 1 minute. You can also count the number of beats for 30 seconds and multiply them by 2, and this will also give you the heart rate. The normal range in an adult is 60 to 100 if you're a person at rest. An athletic individual may have a pulse rate of much less than 60, and this would also be considered normal. However, if an individual is sedentary or sitting and consistently has a pulse rate of greater than 100, this may be indicative of a potential medical problem that warrants attention by your physician. Keep in mind that some things that we consume, such as caffeine or nicotine and smoking, and even some medications can increase the heart rate at rest. Pulse rates in adults at rest that are consistently above 100 are described as being tachycardia, which is an elevated heart rate. A heart rate consistently below 60 in an individual. This is not an athletic individual, and with symptoms such as feeling lightheaded and dizzy may be described as being bradycardia, which is an abnormally slow heart rate. Your healthcare provider will also check your pulse for several things, and they include the following. The rate. This is the number per minute, which is what we just described when we talked about the pulse in the neck and at the wrist. The rhythm. This is, are they occurring in a regular cadence with even intervals between each beat? And then, of course, the force. Is the strength of the pulse weak or strong against your fingers? For example, in your leg or your lower extremities. Is there a strong pulse or a weak pulse? And then we talk about equality. Can the pulse be felt on both sides of the body, in the extremities or the neck, if checking the carotid pulse? Stay tuned and we'll be back after a brief intermission.
I'm Dr. Matthew Wayne Whitus, known as Dr. Wayne by many of you. I'm the founder of Wayne Pharmaceuticals, as well as the MD Whitus Medical Institute. Both are partners in the ownership of this facility, which is the former Esquark School. It was first constructed in 1956 as the first public school built in this county to provide a public education to people of color. It operated as a segregated institution from 1956 to 1970. It was integrated in 1970 and operated as an integrated institution until its closing in 2014. Additionally, we operate our nonprofit entity, the MD Whitus Medical Institute. That entity brings services to the community that will enhance the community and address some of the economic and health issues that affect the community. In Crisp County, Georgia, which is ranked 152 out of 159 counties in the state of Georgia, this very low ranking is because of the high morbidity and mortality rate here in this county. We have a high incidence of diseases that are associated with heart-related ailments such as hypertension, diabetes, heart attacks, strokes. These statistics lead to high mortality rates, which is a premature death rate. We have moved forward with programs to address some of those issues. We house a 15,000 square foot gym, which was recently renovated, and we've hired staff to work with local citizens here, bring on activities that will make our citizens or enhance their abilities to be more active, being more active and exercise that we believe that will bring down some of these bad health statistics. We operate on an 18-acre facility here. We recently acquired 4.89 acres, almost 5 acres from the adjoining church. And we plan to develop this entire facility to someday be able to manufacture our own healthcare products. Our long-term goal is to be able to manufacture on this location with property that we have acquired and that we plan to acquire to manufacture products like Dr. Wayne's aspirin, over-the-counter healthcare products. We plan to do that right here in Cordele, Crisp County, Georgia, on our facility as we develop this facility. We believe that we're going to make a difference as we develop this facility and bring more jobs, particularly in the manufacturing, marketing, and sales area. We look to the community to look at Wayne Pharmaceuticals and look at Dr. Wayne's brand to know that when they're buying Dr. Wayne's products, they're buying quality healthcare products, but they're also doing something that is unique, and that is investing in our community. Investing in communities like Cordele, Crisp County, Georgia. We hire local people from here. We hire local people. We put local people to work. And as we are able to sell more products, as we're able to do more business, we plan to do more of that.
Now with the discussion on body temperature. The most common site for assessing temperature is by mouth. However, the body temperature can be assessed from several sites, and they include, again, the mouth, which is also known as the oral temperature, under the arm, also known as the axillary, the rectal, and ear. For our purposes today, we will discuss the oral temperature. The normal oral temperature range is 98.6 degrees Fahrenheit. and the normal range is from 98.6 degrees to 99.6 degrees Fahrenheit. A temperature of 100.4 would be considered an elevated temperature, and we generally refer to this as a fever. A medical term for this is hyperthermia. A body temperature less than 97.6 degrees Fahrenheit is referred to as hypothermia. Now let's discuss what an abnormal body temperature means to you. Remember, we gave the most common site for assessing body temperatures, that being the mouth, or in the medical community we refer to it as an oral temperature, ORAL. The normal body temperature by mouth is 98.6 degrees Fahrenheit. The normal range is 97.6 to 99.6 degrees Fahrenheit. Do you recall ever having gone to the doctor or been told that you're running a fever and the temperature assessed as being 102 or 103? That's an elevated body temperature, which is indicative of some type of infectious disease or infectious activity going on in your body. So this is out of the norm. On the lower end of that, a temperature of 95. This is what we call hypothermia. A person that has been out in an extreme cold weather for a long period of time. This is a very low body temperature, almost one that would cause death. So the temperatures outside of the norm can generate major body abnormalities, such as the ones that I just indicate. Respiration can be measured by watching a person's chest rise and fall while in a reclining or lying position. To measure the respiratory rate, allow the person being examined to complete cycles for breathing for 15 or 30 seconds. Multiply the number of cycles by 4 if you assess their breathing for 15 seconds, and multiply by 2 if you assess their breathing for 30 seconds. The results of these multiples will give you the respiratory rate for the minute. Now let's discuss what an abnormal respiration rate means in the real world. We gave the respiration rate in an adult as being normal between the ranges of 12 and 20 cycles per minute, or 12 to 20 breaths per minute. Respiration rate of 32, for example, would that be considered normal? No, it's outside of the normal range of 12 and 20, significantly above 20, particularly if we're talking a person at rest. A respiration rate of 32 would be indicative of some type of respiratory abnormality. An example of that would be a person who's suffering an asthmatic attack. If you've ever been around a person experiencing an asthmatic attack or experienced one yourself, you notice that they breathe rather rapidly, struggling to breathe, struggling to get oxygen in and out. They're breathing very rapidly. So they would have a respiratory rate much greater than 20, for example, 32 or even 40. Person with emphysema, same scenario. Trying to breathe and get oxygen in, as well as blowing carbon dioxide that is built up in the lungs out. On the lower end of that, let's say a person that has a respiratory rate of 6. This would be a person that is also in respiratory distress, person that experienced a drug overdose. Many drugs will suppress the respiratory center in the brain and cause a person's respiratory center not to be responsive and almost also depressed. So a person would not breathe within a normal rate and would eventually breathe very slowly and might even stop breathing. So again, we talk about the abnormal rates of being 12 and 20, and these are some of the examples. So that's the discussion and some examples of abnormal respiratory rates. And let me expound on the couple of vital signs that we discussed earlier today. We've given you what may appear to be a lot of medical jargon that you may not understand, but let me put it in simple terms. I gave you the normal values for blood pressure. We talked about systolic and diastolic pressure. We talked about pulse, rhythm, rate, and all of those things, which may not mean anything to you. But let me put it in terms that you can understand. Blood pressure. Blood pressure is a very common measurement that we are very familiar with, and it's something that we deal with on a regular basis as it relates to symptomology, symptoms, things that you experience as a patient. For example, one of the most common complaints when a person is out of kilter or out of the normal range of blood pressure is a headache. If you're an adult, the most common complaint when you're not on your medication or if you're not taking medication is a headache. So that's one of the things that your healthcare provider is going to assess. So if you've got a blood pressure of, let's say, 160 over 110, one of the most common things that you're going to experience is a headache. And maybe a severe headache that may appear to be pounding. And some of the things that may be associated with that, such as a headache with dizziness, red eyes, and even in some instances, when it's severe enough, a nosebleed. So those are things that make that these values have maybe make some sense with you. As it relates to the pulse that we discussed earlier, let's talk about the pulse rate. What is the significance and the importance of a pulse? We talked about the pulse rate being 60 to 100. Well, we want to count those and make sure that first and foremost, the rate is within the normal values. That's the first thing that we're going to assess. Now, the next thing that's important about that rate is that it has a regular rhythm. In other words, there's a regular rhythm, that there are equal intervals between the contractions of the beat. And that is a regular rhythm and a cadence, that the beats are occurring at equal intervals apart, and not a beat and then a skip beat. That's an irregular rhythm, okay? So that tells your healthcare provider that the heart is out of rhythm, and that the rhythm controlling mechanism of the heart is out of whack. The other component about that pulse is the force. The force of that. For example, when you check the pulse and you feel a strong upbeat against your fingers, you feel a strong, that means that the heart is contracting, and is contracting at a forceful rate, and that the arteries are unobstructed, and the tissue that the arteries is supplying is getting adequate blood supply. So if I check your pulse here and I feel a strong pulse, that tells the doctor that your heart is working properly, and that the tissues that are receiving the blood is getting it. However, if you've gone to the doctor, and particularly in elderly people, and doctor checks the lower extremities, like the lower leg, and he barely feels the pulse, but when he feels the bottom of the foot or the lower extremity is cold, okay, that tells the doctor that what? That weak pulse is indicative of a situation where the lower extremity of that foot is not getting adequate blood supply. So it's telling you that now you have what we call a peripheral vascular disease. This is quite common in elderly people who have problems with circulatory problems in their lower extremities. They've got obstructed arteries due to a high cholesterol buildup. So you might have a weak pulse and cold extremities. So the force of the pulse. The next one is, are they equal on both sides? Do the pulse on the left side measures the same as on the right side? Equality of pulse. So all of those are going to be indicative to the healthcare provider of whether you're having good arterial and blood supply to your extremities by your heart. As we leave for today, I would like to recommend that you check your blood pressure on a weekly basis. It's free at your local fire station and retail pharmacy outlets such as Walmart, Walgreens, and CVS. And if you're on an aspirin regimen, try Dr. Wayne's low dose 81 milligram aspirin. That is our message for the day, and thank you until we meet again, I'm Dr. Wayne. Have a good day.